So today we are going to discuss about how to interpret the thoracolumbar spine X-rays. Many of the times students are confused, a little unaware of the facts that what are the structures to be seen. Once you know the normal structures, you can recognize the abnormal structures as well. And so this talk is meant for understanding thoracolumbar spine. The cervical spine X-ray is quite different. Today we will be doing about cervical spine X-ray as well. Let us understand how to interpret thoracolumbar spine X-ray. Most of the time, the question is which one view is more valuable for us to understand the pathology. And many of the students they tell us the lateral view, which is more informative. But the truth is further from this fact. Truth is that the AP view has got a lot of information stored and we can interpret it. Just we have to know how to look at these structures. So let us see one by one. Visualizing the structures on AP view. The structures that can be seen, they are vertebral bodies, pedicles, transverse process, lamina, facet joints, spinous processes, spinal canal, exit foramina, intervertebral disc, and soft tissues. Almost all can be visualized in AP view. What is the risk of radiation? Actually, the amount of radiation for the adults is considered to be safe, but it is not safe for a developing fetus. So whenever there is a lady patient comes to us, must be assured that she is not pregnant. And what is the preparation to be done for the lumbar spine X-ray? The X-rays are usually a routine procedure and not much requirement is needed. But there are certain things that should be done and it is a routine. The patient is asked to remove any jewelry or the metallic items from the body. You must ask the patient whether the patient has undergone any surgery where metal implants have been inserted and is an useful exercise. Ask the patient move the dress and on gown because the buttons or the zippers on the clothes they may affect the quality of the X-ray images. And body parts which are not being X-rayed should be covered by a laid apron to avoid unnecessary exposure to those parts. Now, how to start looking at the lumbar spine X-ray. The coverage is to be seen whether the whole part that we want it is covered in the views or not, and it should be covered in both views. The alignment is seen. The alignment is seen by looking at the corners of one vertebra to the next level. Same vertebral bodies they will increase from size from top to bottom, and also the disc spaces they increase superior to inferior parts. Remember, there can be a fallacy which can come, and it is due to the magnification and spine curvature. The vertebral bodies and the discs at the edges of the image can appear larger than those in the center of the image, and we must check the paravertebral line as well when we are seeing the alignment. Now, all these structures that we have enumerated in the first instance, one by one we will try to see how to look at them. Now, vertebral body and its height. You can see the vertebral body. This is the vertebra and this is the height of the vertebra. If it is compressed, we'll be knowing by looking at the height and comparing height. The intervertebral disc, you see intervertebral disc here, clearly visible in between the two vertebra. Intervertebral disc can be seen very clearly, of course, on lateral view. Now come to the third, fourth, and fifth. This is lamina, pedicles, and transverse processes. Question is how to see the pedicle. So we are going to see the pedicle now. Person or a creature, the pedicle is seen as an eye. You can see these have been colored. These two eyes in each face. Face is the vertebral body. This is the pedicle. Each one is pedicle. And how to see the lamina. Once you recognize there is a pedicle, next step is you recognize the spinous process. The spinous process is seen by looking at the midpoint of the vertebral bodies, and it looks like an arrow. So this has been marked, colored. So these are the spinous processes. Now, once you recognize the pedicle and the spinous processes, a bone which is coming from the pedicle and going towards the spinous process, you see, this is the lamina. This is pedicle, this is lamina, and this is spinous process. Same here, spinous process, pedicle, and the bone which is seen going to the spinous process, it is lamina. And we can recognize a ear-like protrusion from the part of the vertebra. This is transverse process. We'll come to transverse process again. This has been colored transverse process. So these are the structures that we can recognize on the AP view of the lumbar spine. Same here, the spinous processes, pedicle, eye-like structure, and transverse processes. Now let us understand what is the importance of pedicles. See, if you look at a vertebra with two large eyes as pedicles, so it looks like an owl where the eyes are very prominent and the face is small. And the one importance is if there is a metastasis in one of the pedicles, it becomes closed. So these pedicles we can see two are open. Now this is open, but this has become closed. There is no pedicle here. And again, this pedicle is seen here. So this is called, when it is closed eye of the owl, it is called winking owl sign. And it is very pathognomonic of the metastasis. You can see here the owl, eyes has closed this part. Same here, closed. So the winking owl sign is a sign that almost always refers to the bony metastasis. Now the second importance is whenever we talk of the fixation of the spine, the fixation nowadays usually being done is by interpedicular fixation. A screw passes through the pedicle and goes to the vertebral body, and then they are connected by the rods. So this is interpedicular fixation. It is very much in vogue nowadays. What is the surgical importance of lamina? Remember, in case of PIVD, basic surgical procedure done is laminectomy and discectomy. Means you remove the lamina and go to the part of the intervertebral disc and remove the disc. So if you remove the lamina, the X-ray will definitely clear about it and how to look at those X-rays. You can see here my cursor going. Now see the vacant space in this part. It should have been like this. See, this lamina is here. It is not vacant like this. This means the lamina has been removed along with the spinous process. Neither spinous process is here nor the lamina. Part of the lamina and spinous process removed. This is post laminectomy X-ray. There can be a situation when after the removal of the lamina, many of the surgeons prefer to fix the spine by interpedicular fixation. Here, this is the case. Laminas have been removed in a part of the vertebral bodies and then it has been fixed by interpedicular fixation. This is a transverse process which has been fractured. It is visible here. And let us understand the importance of the spinous processes. You have to look at the plane of the spinous process. If the plane is not in one line, it should be in one line. Then it is a case of scoliosis. Now let us look at the facet joints. Facet joints can be seen in between the two articular processes. Here is the facet joint. You look intently, carefully, you will be knowing it. And see here, facet joints, facet joint, facet joint. But most of the time, oblique views give a very clear picture of the facet joint. So here, in oblique view, see facet joints more clearly. Now, a spinal canal, you can measure the spinal canal in transverse diameter. Based on this, you know which patient has got spinal canal stenosis and which are having the normal spinal canal. Sacroiliac joints are clearly seen. This is the sacroiliac joint. See, this one is a normal SI joint and this has been destroyed. It was found to be due to the septic arthritis of the right-sided SI joint. You can see the psoas muscle shadow, clearly seen. Of course, it is an MRI, but it is clearly seen psoas shadow. And then not forgetting to look for the soft tissue shadow, especially in the case of carriage spine or Pott's spine. It looks like a fusiform swelling. And check for alignment. In epiview, you have to see the alignment of the spinous process and the lateral border of the vertebrae for alignment. Now come to the lateral views. In lateral views, most of the structures are visible. Vertebral height, disc spaces more clearly in the lateral view is visible. Lamina, pedicle and facet joints, superior and inferior articular process more clearly visible, and the intervertebral foramina is visible clearly. Now start with alignment. Anterior border and posterior border of the vertebral bodies is to be looked into. Then we will see here this corner of the vertebra, this corner vertebra aligned, this corner aligned. Now here it is not aligned. It has, so L4 vertebra has slipped anteriorly over the L5 and this condition is called spondylolisthesis. We will see the vertebral height more clearly in the lateral view and you can see it here. This vertebral height is normal. This one is also normal, but in between the two, it has been compressed. Loss of height. Here again, one vertebra, normal height, it has been reduced, and again, normal height. We can see different structures. Say, for example, pedicle. Pedicle is seen like this structure most of the time. This pedicle, and from pedicle towards the spinous process, bone is going, this is lamina. And facet joints is also visible. We will see the facet joints more clearly. So this is the facet joint, the superior articular process. This is the superior articular process, and this is inferior articular process. And then come to the exit foramina. This is the exit foramina through which spinal nerves come out. Now, how to recognize spondylolysis? The spondylolysis is characteristically called a dog which has been made on the vertebra on the oblique view and his neck or the collar is disturbed or cut. Let us understand how to make dog in the oblique view of the spine. This is the transverse process, this looks like a nose. In oblique view, this looks like a nose. The pedicule, as usual, looks like an eye. And superior articular facet looks like ear of the dog. And the neck of the dog, this part is called pars interarticularis. The inferior articular facet looks like the front leg. So the dog is completed. And he has a neck here. And any chance if neck is cut, this condition is called Dilolysis. So a break in the neck of the dog or dog collar corresponds to a fracture in the region of the pars interarticularis. It is specific for Dilolysis. There can be bamboo spine. This is pathognomonic of ankylosing spondylitis, where vertebra on each other they fuse. Go through the slide a few times. I am sure you will be competent to interpret the X-ray of the spine. Thank you very much.